Vaginal dryness can cause issues like discomfort just on a daily basis and often pain with sexual activity. If you're dealing with vaginal dryness, you're not alone. This is a common condition, and in this video, I'm going to talk about what causes vaginal dryness and what you can do to help treat it. I'm Dr. Alex Hill, your physical therapist for everything pelvic health. Let's get into it. Vaginal dryness can feel like burning, itching, discomfort, and soreness. It can even cause bleeding with penetrative sex. It can cause bladder urgency and frequency and recurrent urinary tract infections or yeast infections. If you have vaginal dryness, it's important to determine why you have vaginal dryness and don't just assume the reason. So if you are dealing with vaginal dryness, make sure that you get assessed by your medical provider first to determine what's really causing that dryness. Vaginal dryness is most common among those who are perimenopausal and postmenopausal. So those who are going through menopause and who have already been through menopause. That's because after menopause, the estrogen levels drop, and that causes changes to the vaginal tissues. Like they get dry, they can get thin, irritated, less flexible, and that can lead to those symptoms that I mentioned earlier, plus that pain with sexual activity. Besides menopause, other common reasons that you might be having vaginal dryness include if you're breast or chest feeding after you deliver your baby, smoking, which absolutely kills your lubrication, medications like antihistamines for allergies, birth control pills or hormonal birth control, and even medications like antidepressants. Other causes include medical conditions like diabetes, Sjogren's, which is an autoimmune disease where a key feature is dry mucous membranes, meaning your eyes are dry, your mouth is dry, and your vaginal tissues are dry. Cancer treatments, including pelvic radiation, surgery, and chemotherapy that induce menopause can also lead to vaginal dryness. You also want to take a look at what you're doing during the day. So are you douching, using soaps and perfumes at the vulva and vagina? Those can definitely dry out the tissues and cause a lot of irritation. And finally, if you're not sexually aroused, then that can also lead to vaginal dryness, especially when you're trying to be sexually active. All right, so we know the why, but now how do we actually treat it? So your treatment will depend on what's causing it. If you're douching, stop douching. If it's medication related, talk to your medical provider. Make sure that you're staying hydrated and drinking plenty of water during the day, and also make sure that you're spending plenty of time with foreplay to help increase your arousal, which will then also help increase your moisture and your natural lubrication. So now let's talk about estrogen. So local estrogen in the form of a ring, a cream, or an insert can be prescribed by your medical provider, but not everybody is a candidate for this. The localized estrogen at the vaginal tissues will kind of help with rebuilding and plumping up the tissues with moisture and with lubrication. Again, this is a great option for a lot of people, especially if this is hormone related, but always talk to your medical provider if this is a good option for you. All right, now let's talk moisturizers. This is going to be really helpful for the majority of people who have vaginal dryness because these moisturizers are not hormonal. You don't need a prescription. You can just pick them up at the store and it's pretty easy to use them. Vaginal and vulvar moisturizers help with improving tissue quality by increasing moisture and elasticity or movement of your vagina and vulva. These moisturizers are different from lubricants, which are used only during sexual activity. If you need more information about lube, check out the link in my description below and at the end of this video where I talk about different lubricant types, ingredients to avoid, and what is the best lubricant for you. Now again, lubricants should only be used with sexual activity, while moisturizers should be used at least 3 to 5 times a week and using it long term. Some people may find that even using moisturizers daily is really helpful for them and gives them a lot of symptom relief. Moisturizers that I recommend or that have been studied a lot in the research are suppositories, which are solid capsules that you insert into the vagina and they get absorbed into the tissues. 3 suppository moisturizers that I like are Hyalogen, Reverie, and Key suppository. Moisturizers that I recommend that you can use at the vulva and the vaginal opening include V-Magic, Good Clean Love, Replens, and oils like coconut oil or vitamin E oil. You do not want to use petroleum jelly or Vaseline as a moisturizer because this can irritate your vagina and vulva and can also raise your risk of getting a vaginal infection. Additionally, be careful with oil-based moisturizers because they can break down or damage latex condoms and dental dams. So, how do you use moisturizers? I recommend using the moisturizers at nighttime so that they don't make a mess for you during the day from kind of leaking out, and they're able to be fully absorbed throughout the night. You want to always wash your hands, and if you also use vaginal estrogen, don't use it on the same nights that you're using the moisturizers. For the suppositories, it's easiest to lie on your back or semi-reclined position in bed, and then you're going to separate the labia, and then you'll either gently push the suppository into the vaginal opening or use the applicator that the product came to insert it deep. For moisturizers that you're using at the labia and the vaginal opening, you just put a small amount of moisturizer on your clean finger, and then again, you'll separate the labia, and you're going to just gently massage that moisturizer at the labia and into the vaginal opening. So some of my favorite moisturizers are linked in my Amazon storefront that is in the description below. I hope that you found this video helpful with kind of demystifying vaginal dryness and starting on a path to more comfort. If you found this video helpful, please like it and subscribe to my channel for more pelvic health content.